Hello, my name is Courtney Brax and I'm here to make the medical expense deduction a little less taxing. Oftentimes taking care of a dependent parent, including paying for his or her medical care, is expensive and inevitable. You may be wondering exactly what expenses and how much you can be deducted on your personal tax return. First, you may need to determine which expenses qualify as a deductible medical expense. In general, to be deductible, a medical expense must treat, cure, or prevent illness or injury. This includes the cost of doctor visits, surgery, prescription medications, hospital stays, physical therapy, and medical devices such as hearing aids or wheelchairs. Also, the expense must be paid by you for either yourself, a spouse, or a dependent. The expense of staying in a senior care facility, including room and board and other services, may be deductible as a medical expense only if the primary reason for the stay is for medical nursing care. While this may seem obvious, keep in mind that there are many kinds of senior care facility options available today. Some offer independent living apartments or condos, meal plans, housekeeping, recreational activities, and so on. If the primary reason for the senior living option is simply to have a maintenance-free lifestyle, then these expenses generally are not deductible. The IRS has stated, however, that if an individual has Alzheimer's or other types of dementia and resides in a care facility, it is presumed that the primary reason for the individual's stay is to receive medical treatment, and thus the entire cost of the individual's stay, including medical care, room, and board, are deductible expenses. However, personal hygiene items and general health items, such as toothpaste or vitamins, for example, do not qualify as medical expenses. Although these items are not deductible, you may provide them for your parent and include them in figuring the total amount of support you provide when determining whether or not you can claim your parent as a dependent on your tax return. Once you have determined which medical expenses are deductible, you should consider whether or not you should actually claim them on your tax return. Medical expenses are an itemized deduction claimed on Schedule A of Form 1040. If you aren't certain whether you should itemize, consider whether or not adding the qualifying medical expenses would make it worthwhile, or whether the standard deduction provides a better tax benefit on your tax return. In addition to the itemized deduction hurdle, only a specific percentage of the total medical expenses may be deducted. Currently, only the portion of your medical expenses that exceeds 7.5% of your adjusted gross income can be deducted. This means that only the expenses over that 7.5% threshold are deductible as an itemized deduction. Overall, moving a loved one to your home or to place him or her in a care facility is a very personal matter involving decisions on many levels. I hope this tax talk helped you understand some of the tax implications of this important decision. Thank you.